Welcome to Section 7 of Cardiovascular Anatomy. In this section, we'll discuss the vasculature of the gonads. This table lists high-yield information regarding the ovarian artery and vein, as well as the testicular vein and the testicular artery. And we will start our discussion by discussing the ovarian artery. As you can tell from this image, we have the aorta, and both of the ovarian arteries branch from the aorta, as you can see right here. Now, if the ovaries get twisted around the infundibulopelvic ligament, or the IP ligament, the ovarian artery can be blocked, leading to ischemia. And this is called ovarian torsion. The IP ligament is discussed in the reproductive anatomy chapter. Now, going back to the table, we see that both ovarian arteries arise from the aorta. And in the case of ovarian torsion, the ovarian artery can be blocked, and this causes ischemia. Now let's talk about the ovarian vein. Now, the ovarian veins follow a different pattern than their arterial counterparts. The right ovarian vein, which you can see right here, drains directly into the IVC right here. However, the left ovarian vein right here drains into the left renal vein right here. And from there, it drains into the IVC. Now let's talk about a high-yield pearl, septic pelvic thrombophlebitis. This condition occurs in postpartum women. What happens is thromboses form in some of the pelvic veins, especially the ovarian veins. Pregnant patients have a higher risk of clotting and forming these thromboses in the pelvis. They can lead to sepsis, which is why the condition is called septic pelvic thrombophlebitis. So the postpartum patient can become very sick. Now, make no mistake, this condition is very rare. A much more common cause of postpartum sepsis is infection of the uterus, which is called endometritis. So why do you need to know about the rare condition septic pelvic thrombophlebitis? Well, because it presents so similarly to endometritis, so it can be a very clever distractor on board exams. Clinically, if you have a sick postpartum woman and you have ruled out all of the other more common diseases, don't forget to think about thromboses in the ovarian veins. So for the ovarian veins, just remember that they can experience thrombosis in septic pelvic thrombophlebitis. Now let's talk about the testicular veins and arteries. The testicular arteries and veins follow a similar pattern to the ovarian arteries and veins. So let's start with the arteries. Here, you can see both the right and the left testicular arteries branching from the descending aorta right here. An important clinical tie-in for the testicular arteries is testicular torsion. In this condition, the testicle will twist around the spermatic cord, blocking the testicular artery, causing ischemia of the testis. This is considered an emergency. The testes need blood through the testicular artery. So now let's talk about the venous system. Each testis is drained by the pampiniform plexus, which you can see right here and right here. And each of these plexuses drain into their respective testicular vein, which you can see right here and right here. The right testicular vein drains back directly into the IVC, while the left testicular vein drains into the left renal vein first before traveling to the IVC. So now let's do a question. A 22-year-old male presents with excruciating right testicular pain. Physical exam demonstrates that the testicle has wrapped around the spermatic cord. Doppler ultrasound reveals decreased blood flow through the testicular artery and the presence of venous congestion. What vascular path would this deoxygenated blood normally follow to reach the heart? Now, hopefully you've noticed that this patient has testicular torsion because the testicle has wrapped around the spermatic cord. And this leads to the ischemia and the pain that he is experiencing. Whenever you read deoxygenated blood, as in this question, you should be thinking of blood that has already delivered its oxygen to the tissues. This should make you think of venous blood. In testicular torsion, we know that the testicular artery can be compressed, but the testicular vein can be compressed as well, which is what we're talking about here with this patient's deoxygenated blood, their venous blood. So how does the testicular vein reach the heart? Well, in this patient, we know that he has right testicular pain, so we should be thinking of the right testicular vein. And how does it reach the heart? It goes directly into the IVC and then goes to the right atrium.